Good morning, everyone. I'd like to ask all of you to take your seats. We're about to get started this morning. I'd also like to welcome all of you in the room and on the web to today's event on the annual State of Biomedical Innovation here at the Brookings Institution. I'm Mark McClellan. I'm the director of the Engelberg Center for Healthcare Reform here, and today's conference is part of a series of public events and other activities that we support on biomedical innovation. Our past topics in this area have included issues in improving the clinical development pathway and the regulatory review process, as well as new reimbursement models for innovative products. We're going to keep coming back to those issues, and you'll see we'll touch on them today as well, because this is a really critical topic, and we hope that today's discussion will help set the stage for ensuring that policies that are aimed at improving innovation are having the maximum impact possible. This is a critical topic because of the importance of biomedical innovation. Without a doubt, improvements resulting from biomedical knowledge have had a transformational effect on the lives of Americans and people around the world because of their impact on the treatment of virtually every health problem facing people around the world. But as we've seen more opportunities for innovation, we've also seen the costs of biomedical research increase. We haven't seen a proportional increase in the rate of biomedical progress, and many believe that more resources in early stages of development, while very important, may not be sufficient to address the problem. It's like to say that that support for the inputs, more spending on biomedical research at the NIH, finding ways to get more support for biomedical research in the private sector are both really important. But research and development isn't just about the levels of funding. It's also about improving the certainty, the efficiency, and the predictability of the development process so that good ideas can be translated into safe, effective, and reliable products as quickly and efficiently as possible, so we get more bang for the buck for all of that spending. And in turn, that might lead to even greater support for further investments on both the public and private side. So if we really want to make progress in getting better products to patients more quickly, this is a critical topic. And if we really want to make progress on identifying which policies are working best, we need measures. We need metrics to know how we're doing throughout the entire development pathway, the preclinical phases, the clinical phases, regulatory review, and post-market use of medical products and post-market innovation in how products are used. So in this event, we want to go beyond looking at just the overall levels of public and private investment in research and development, important as those are, and look at some of these other factors that also have an impact on the efficiency and the productivity of the biomedical enterprise. Part of the reason for emphasizing metrics that we'll discuss later on in this session is to help us focus in on steps that can measurably help us improve the development process, the research and development process. So that brings me to the goals of today's events. What we want to focus on is to start a dialogue around the places in the development pathway where new policies affecting biomedical innovation can have the greatest impact, and we want to link that to a discussion of metrics to help answer the question, how do we know when we're really making progress in these areas? These are topics that obviously have been the subject of a lot of discussion, not only here in our work at Brookings, but in many other efforts in conjunction with the just passed FDA legislation, in conjunction with private sector initiatives, in conjunction with efforts by the NIH and others to promote more biomedical innovation. And so we're going to come to these, do a more detailed discussion of these steps during the course of the day, hopefully with leading to some identifiable next steps for how we can do more to understand not only which policies have the most promise, but how do we know whether they're actually having an impact. So we're going to do that through two main panels. Our first panel will include some discussion of the collaborative steps that are being taken in both the public and private sectors to make this kind of progress, to validate disease models and markers, to enable faster and more efficient clinical trials, to create more efficient mechanisms for developing additional safety and effectiveness evidence once products are approved. This will include Francis Collins from the NIH, Commissioner Peggy Hamburg from the FDA. They will be talking about some of the ways in which NIH and FDA are supporting innovations in the process of research and development and in collaboration, in many cases, with the private sector. We'll also hear from Kevin Shearer, who led the PDUFA negotiations for the pharmaceutical industry. He'll be providing an industry perspective on the innovation ecosystem. And we'll also hear from Ron DePeno, who recently took over at MD Anderson. He'll be sharing his ideas and some of the steps that MD Anderson, as a leading academic center, is implementing on improving the research and development process. After we hear from that first panel, we're then going to turn to that further discussion of metrics that I described. So implementing policies accompanied by better knowledge of whether these policy reforms are effective. There are a lot of well-known metrics in this area, things like investment levels, the number of new products entering the market, but we want to augment those and discuss those in more detail as well. For example, one of the metrics discussed in some of the recent FDA reform legislation is the evaluating how often products have repeat review cycles at FDA because that may relate to the predictability of the FDA review process, and whether and how many therapeutic areas use surrogate markers, biomarkers that can be measured in the short term for valid, predictable information on whether or not a longer-term clinical benefit actually exists, thereby potentially reducing the time for clinical trials. The background document, which you all have, outlines 4 areas where it's important to assess performance and develop and improve potential metrics, and our speakers during the second panel represent some of the leading experts from the investment community, the medical device community, the academic communities on these topics. In their opening remarks, they'll talk about what metrics they think are most meaningful and how to collect the relevant data. So we're hopeful that one of the outcomes from this event will be a continued and strengthened partnership with the people who are involved in today's discussion, hopefully leading to more extensive, validated dashboard for measures that could be updated regularly to support more efficient and systematic evaluation of policies and thereby generate more support for the policies that have the most impact on improving the biomedical R&D process. This event will be a success if people leave here today with a better understanding of what it's really going to take to improve the research and development process and to get treatments to patients more quickly and reliably. And also, if people leave here with a renewed interest in the importance of tracking how we're doing to generate more support and more effective support for these critical policy issues. In order to help us facilitate this discussion, you all were provided with a discussion guide this morning along with today's agenda and the biographies of the participants. We've also got printed handouts of a few slides that we're going to have presented during our second panel discussion. Also in the packet, there's a brief 8-question survey. That's the blue sheet. We want to have events that are both interesting and productive, and we really welcome your feedback regarding today's conference. So we'll hope you'll take a minute or two to complete this survey after the event. We'd really appreciate it. There's a place at the registration table where you can drop those off. Today's event's a public event. As press are present, and the event is being webcast live and recorded, so everything here today is on the record. And we hope to move the discussion along pretty quickly. For those of you who are on the panels, our timekeeper, Paul, up here in the front, is going to help remind you of where we are in the process. And throughout the morning, we'll have several opportunities for all of you who are here in the audience to ask questions and make brief comments. We do want this to be interactive, so when we get to that point, we will have microphones moving around the room and come to you to enable you to ask your questions so that people who are listening online can hear it as well.